Hello and welcome to this section about wound management and looking at skin. So it makes sense that we start off with just to understand a bit more about the skin and the anatomy of the skin. We're going to look at some wound management techniques. We're going to look at different types of wound dressing, not in this presentation, but throughout the next few bits. And then we're going to look at the pressure sores and ulcers, etc. But it already starts off with the anatomy and physiology of the skin and how the skin heals, so the wound healing process. And for us to have an understanding of this, we need to get in quite deep, and we need to look at a lot of pictures to understand what good skin healing looks like and what poor healing looks like. Equally, through this module, lower down, I have given you lots of additional reading here. There's some external courses which I highly recommend you do, which are going to be far more superior than what I'm showing you in here, because obviously I'm a mental health nurse, this isn't my area of expertise. However, I've got enough information to get you through the modules, but if you want to advance then, and you want to do skincare and tissue viability, I highly recommend you do. Again, we know that tissue viability and skin assessments is a specialist area of nursing, so there's a whole specialism in its own right. So we'll get through this and hopefully it'll be enough for you to identify what healing looks like, what's good, what's poor, and we can take it from there. So the aims and objectives today is to understand the underlying structure of the skin, to gain a basic understanding of the process of wound healing, and to be able to identify different types of areas such as the wound bed, the wound edges, and the surrounding skin. So before we get started, why do you think it's important to know the structure and functions of the skin? And hopefully you're going to go, well, because the skin is the largest organ of the body, it's the one that's going to cause us the most problems. So when we do an assessment, we can do observations, and it's something we can see quite quickly. Equally, knowing the structure of the skin and how it's produced and how it heals will give us an idea on the length of how long it'll take for a wound to get better. And if it doesn't start to get better, then we have an idea that there's maybe a problem in there. Now, throughout my 30 now plus years in health and social care, I have seen skin and wounds from some minor ones to some very acute ones. I've seen tiny pressure sores, but underneath it you can see tunneling, and that's where basically the ulcer has gone from the bum right up through the spine and across the shoulder blades. I've seen whole pressure sores that you can put your fist in. I've seen complete anatomy down to the bone of wounds. So I've got a visually good idea about the importance of knowing the correct procedures and obviously the functions of it. Equally, wound management is one of those advances in nursing that constantly is progressive. So we will do another slide on different wound dressings, different treatment types, but to keep on top of this is a real CPD thing for yourselves. You know, I don't want you treating or dressing wounds unless you are fully competent, that you're fully up to date, and that you have been assessed by a physical health nurse as competent in doing so. But I will show you how to obviously clean wounds and how to do the minimum stuff, but you should be following treatment and care plans. So first of all, what do the skin layers consist of and what do they look like? Well, here you can see a very typical cutaway of a piece of skin. So we already know it's the largest organ in the body, made up of the two layers. We've got the epidermis, which is the very thin layer attached to the dermis. And then underneath we've got the dermis, and then we have the subcutaneous layer, and that's where we obviously have our fats and things. Equally, through the cross out, you can see you've got the blood supply, and you've got the hair follicles and how the hair grows. Now, Just a bit of an idea of the thickness, the epidermis, so that very first thin layer on eyelids, it's 0.1 millimeters on the eyelid, and on the palm of our hands and feet, you're roughly looking at 1 millimeter thick. So very, very small. And that's why when we're looking at those intramuscular, subcutaneous injections, they're only tiny, tiny needles because they don't need to go in that deep. The acidity of the skin, so should be a balance of pH 5.5. And again, looking at the dermis layer, the deeper layers composed of those different fibers there that allows for the skin's elasticity and its strength. So does the skin vary in depth in different places of the body? Well, the answer is yes. So on the eyelids, it's thinner on the eyelids than it is on the soles of the feet. And obviously the skin is the largest organ of the body, and it weighs between 6 to 8 pounds. And it can cover an area of 20 square feet. So it's a fairly impressive organ of the human body. Can you name the functions of the skin? So the function of the skin, ideally, is to keep our organs and bodies in place and to allow us that strength and movement in line with the with our muscular system and skeleton system. So the function of the skin is to protect the internal structures, physical barrier to microorganisms and foreign matters, and the acid pH levels help to provide and protect us against prevention of infection. So skin damage impairs the ability to carry out functions. So ordinary washing can restore our pH levels. And again, if we're looking at poor hygiene, etc., it can alter our pH levels and cause a real problem. So again, when we think about personal hygiene and capacity and consent, we need to keep that pH balance around 5.5. And again, if we have people that aren't washing for prolonged periods of time, that pushes the risk up for infection. It increases the risk of the skin integrity to break down and can cause an umpteen amount of problems. So the functions of the skin is part of our nervous system, and it allows our sensory perception. So it allows us to feel pain, pleasure, heat, and identify potential dangers and avoid injury. And equally, when we get that goose pimple feeling and those hairs standing on end, that's our subconscious level warning us that something's not necessarily quite right, and it puts us in the fight or flight syndrome. Parts of the skin layer obviously contains our heat, and our blood vessels contain that obviously is part of our body temperature. So our body goes through that homeostasis stage, where if it's too hot, we shiver. If we're too cold, we shiver. If we're hot, we sweat. So it allows us for our cooling systems. Equally, our skin goes through excretion. So we sweat through our skins. So it's an important part to think about when body goes into shock. We can be losing shock through sweat, not just through bleeding, but obviously through the transmission of body water. And again, maintaining hydration and fluids helps us to prevent dehydration. The function of our skin also acts as a solar panel in some ways, because it takes the vitamin D, turns that into vitamins in which is useful for our skin growth. And if we remember anything from our science lessons at school about plants, where photosynthesis, where we need the light, the warmth, all of that, we do a very, very similar thing. So if we can't get vitamin D from natural sunlight, good for skin repair and cell repair and all of the other stuff, then ultimately we need to be thinking about supplements. So if we are institutionalized, if we're not coming out of our houses or homes, we should definitely be thinking of a vitamin D supplement. So part of the function of the skin as well is absorption, and some substances can be absorbed directly into the skin. And we know that because we have topical creams. So we know that we can absorb directly through our skin into our body. Part of the function of our skin was to communicate to our body, again, through the effects of heat or cold, through pain and sensation, or that something isn't right. Now, the problem with skin is we go through a natural aging process. So when we're at our best, it's got its elasticity, it's nice and thick, we can pull it up, it goes back, we haven't got any problems, and we should be able to observe signs of dehydration. When we go through the aging process, the skin flattens, it starts to wrinkle a little bit, the epidermis starts to increase, and it starts to wrinkle. And the problem there is we get a decrease in sensitivity to pain perception. So this is why when we're washing people of the aging population, we should be doing those bath temperatures. We should be measuring the bottom of the bath, the middle of the bath, and the top of the water, because they won't feel as if they're burning. There was an incident quite a long time ago now where an old lady in a nursing home rolled over at night and she stuck to the radiator. She died, obviously, through the burns that she had, but she just didn't feel it. So because of the aging process and her skin not sending that transmission back. So we need to make sure that with the aging population, we protect them from the effects of heat and cold. So again, with the aging process, the epidermis becomes thinner and flatter, it loses its collagen and pigmentation, skin becomes wrinkled, it loses its elastic fibers, and skin becomes dry as a result of this. So that's our little overview on the skin itself. So now let's look at how wounds heal. So first of all, we need to have a classification of wounds to have an idea of those. And again, I've given you the classifications with nice guidelines on this site. And here, wounds that heal primary intentions, e.g. So normal cuts, incision wounds and all that lot. Wounds that heal through secondary, through pressure ulcers, or wounds that heal by tertiary inventions, by delayed structure. So we've got our normal wounds, that's just cuts and things that heal normally. We've got our secondary intervention, so that's through pressure ulcers and skin breakdown. And we've got a third, which may be through tertiary interventions, so delayed interventions. And they're described as characteristics of acute or chronic. So acute wounds, categorized by no underlying problems, i.e. trauma, short durations, no inflammatory phase, and they heal and do not break down. So these are normal wounds. So this one, if you remember from the first aid we did, looks like an incise wound. There's no other trauma there, so it should heal quite nicely. It should be a short duration because that should just heal up within 2 or 3 days. And there's no inflammatory phase, and it doesn't look like that's going to break down. But then we have chronic wounds, characterized by underlying pathology. In other words, there could be infections in there and other problems. There could be a lack of blood supply, so the capillaries and all of that lots broken down. There could be a prolonged duration, so because of the chronicness of the wound and the size of it and the damage to the tissue and the muscles and the capillaries and the veins or the blood supply, it's going to have a problem there. And obviously, we can see that it's going to stay in a hypertensive state and it will remain in a persistent state of inflammation because of that chronic infection in the wound. Now, wounds go through the typical 4-model healing stage here. So the homeostasis part is, as soon as we cut ourselves, our body releases the platelets to the surface and says, right, let's plug this bleed. Okay, this is the first phase of wound healing. It happens immediately between 0 to 3 days. During this phase, there's an increased blood supply with platelets going to there to temporarily plug, and obviously it forms a mesh over the body to attempt a clot of bleeding, and homeostasis occurs. The blood clot scabs up, and that obviously becomes a barrier to stop infection come in or out. So our first part is just stopping the bleed and stopping infection. So that's our homeostasis phase. Between 1 and 6 days, then we get an inflammatory response. So this is where the white blood cells are going to go in and they're going to try and reduce any infection, and they're going to try and tidy things up. And again, following the natural inflammatory response, it causes the widespread of maybe some swelling or edemas, the fluids and things. And these obviously are there to protect against viruses and bacteria. And also they destroy anything that's there. And obviously is an essential part of the wound healing process. So white cells are involved in the immune response system. So what that will mean to us is if you have an immune deficiency, so if your HIV status isn't under control, or you're diabetic, your inflammation stage of wound healing could be really poor, and therefore it's going to take much longer for you to heal. Prolification stage, I think I'm saying that right, is between 3 and 24 days. And this is the stage where it's supporting the structure of new tissue. So underneath the scab, you can see that new tissue is forming, that the red cells and the white cells are kind of stripping away a bit. It's introducing new fibers to create that new structure under the scab. And obviously it's part of our body's response for bringing the skin together and part of that healing process. So it's basically the new scaffolding for new tissue to be forming. Okay. And then finally, looking at the remodeling stage. So this is where the white platelets and all of that lot are disappearing. The fibers are kind of standing back. The new myofibrous bits are coming back in. The tissue's now formed quite nicely, and the new remodeling has happened. So the new skin is ready to go. And then it increases the collagen and the tissue strength around the wound. And it starts to then, the stage starts to overlap. So wounds get stuck in this phase and then move back if the healing isn't right. So it's quite important through the this phase in the last, in the last parts there, that we're making sure that the skin covers and obviously the remodeling works on the tissue. So here, what stage of healing does this look like? So this looks like quite an open part. It looks like an open wound. And here we've got obviously the issue around the blood loss and maintaining the blood. So it's the start of the process. And hopefully what we would be having there, because it's the start of the process, we should be at the homeostasis stage. So that's where the blood is going to start to congeal, gets a bit darker and thicker, and it's trying to heal up. So what stage of this does it look like? So it's not bleeding anymore. So bleeding has stopped, but equally, it still looks quite red and tender. So here we're looking at the inflammatory stage. So this is the white cells fighting off any infection. And during that, sometimes it can weep a little bit because that's the white cells doing their job, trying to keep it clean and everything. Then we've got where it starts to kind of granulate over, and you've got that pink tissue around the side of the white bit, and it's looking nice and red on the inside. That's the proliferation stage. So that's the final stage before that. So underneath that, the tissue's starting to knit together, and you can see around the edges, the tissue's trying to rebuild. So it's rebuilt around the side and underneath with those new fibers. And then finally, this is the remodeling stage where it's trying to put it all back together. And again, happens at the very end. And again, can cause scarring. So depending on the size of the wound, we need to think about how we can minimize that. So what factors affect wound healing? And here we've already thought about some of those, but we know aging is a problem because we've just discussed the fact that in the aging process, the skin becomes thinner, it loses its sensitivity. Anemia, so we've got a problem with the blood supply going there. Lack of nutrition because we haven't got our vitamins, minerals to repair the skin cells and to do everything. If you've got medical conditions, or you're on anti-inflammatory medication, chronic diseases such as diabetes, we've just covered that. Other infections, so the body's already fighting an infection thing. Problem around oxygenation, so if you've got respiratory problems because you're not getting that good supply of blood and the oxygen back to the tissue. Smoking, because smoking destroys the tissue and the oxygen in the blood. Psychological factors, so again, things such as low mood and depression, and obviously body temperatures. So lots of things there to think about when looking at factors of trying to heal the system. So local factors then, so if we're looking at problems, we then need to think about the blood supply, looking at any local infections, looking at anything embedded, looking at the sites, the anatomical site, and looking at the size of the wound. So again, depending where the wound is will depend upon how hard it's going to be for it to be cleaned. So for example, if it's under the breast, if it's in an area where it sweats, if it's in the crease of the bottom, if it's around the groin, if it's on the foot, these are all places where our body naturally excretes and therefore it's going to make it harder for things to heal. Equally, the further away from the heart, the harder it is for the body to repair, because again, if we think about our foot, it's the furthest part away. So again, it takes longer for things to repair. So when we think about the assessment of the wound, we need to think about, are you qualified? Are you trained to do the assessment of the wound? Do you know what you're looking for? And do you have the right equipment to do this? So you should ensure that you should have a treatment plan to hand. In the treatment plan, you should obviously have your measuring device. So that's normally in the wound patch. You've got your aseptic techniques that you will have been taught. Again, to take a picture of the wound is really helpful. And you need to measure the depth of the wound as well. So we need to know if it's growing, if it's going deeper, and you're going to be using your visual sight. So does it smell? Does it look red? Can we see other things? Remember, the selection of dressings or bandages without accurately undertaking a wound assessment into account could cause the delay of the healing process and could result in costly treatments that are inappropriate and not successful. So the selection of the wound dressing is absolutely paramount, and we've got a whole module on selecting the right wound dressings. So different appearances of the wound are really important. So if it's black, we're saying it's necrotic, so it's dying, it's dead tissue. Yellow, it's sloughing. Red, it's granulating. Pink, it's the epithelializing, so that's the wound remodeling and healing. And if it's green, potentially infected. So characteristics of granulation on tissue. So healthy tissue should look bright red, should be moist, should be a bit shiny, and does not bleed. So that's all healthy. Unhealthy tissue, so dark red, dehydrated, dull, and bleeds easily. Okay, so we obviously want healthy tissue, we don't want unhealthy tissue. And here you can see it needs to be kept slightly moist. So dressing selection is really important here, because if it dries out too quick, the top of the wound could encourage that remodeling, but underneath it hasn't had a chance to heal from bottom up and can cause a real problem. So it's really important that when we look at dressings, we're picking the right dressings. So Granulation is that bit around the side, and you can see it all kind of popping up and it looks a bit lumpy, and that's signs of the healing process. It go necrotic, so black is obviously a terrible sign. It means the tissue's dying, and that's, if you see that, obviously you need to get immediate medical attention. And slough is, again, it's another part of that healing tissue. It's going pink, and you've got that yellow healing phase on the top. So the importance of the surrounding skin, we're going to rub at that. So the edema, sorry, and so looking at any edemas then, so that's where obviously the skin's just filling up with liquid. So again, if you are getting edemas, things like that, again, you need to make sure that you're referring that on and getting the right treatment. And it's not uncommon for eczema and dry skin. So again, just making sure that you're measuring all of the areas of eczema and dry skin, because if the skin's dry or other problems there, that can cause problems with the healing. When you remove the dressings, you need to record what's coming off, so the excretion there. So does it smell? Is it green? Does it look horrible? And what's the consistency? So as you write your notes up, that's what you're looking for. And equally, you're going to be addressing pain. So how bad was it on a scale of 1 to 10, the intensity and the site, and what actually made it feel better. And finally, you're going to look if there are any changes in the wound. You're going to report that immediately to your nurse in charge, and any delays in reassessment may result in inappropriate treatment. So in the first part of this, we've looked at the anatomy and physiology of the skin and wound healing. We're now going to have a look at some of the choices of dressings. So this section then looks at what dressing for what wound. So again, this is just to give you a bit of knowledge and oversight. Obviously, you would be working alongside registered nurses, you'd be following the care plans as well, but at least it gives you a bit of insight. If you had to choose a dressing, you've got something where you can go back to have a think about. But remember, it should be evidence-based, so going on to nice guidelines, making sure you're up to date with all of those is really important. So we talked about the wound assessment in the previous section, and here we need to make a decision under our wound assessment, because our wound assessment is going to decide the type of dressing in which we're going to apply. The assessment looks at the factors of the wound healing process, factors that affect the process, and optimal conditions to obviously help that wound heal. When we do our assessment, we're going to be using our eyes to see what it's like, our nose to smell anything, our ears to hear what the patient's telling us, our mouth to ask the right questions, and again, our own knowledge and product knowledge. So again, there are so many dressings and techniques out there. It's really important you're up to date with those. So it's not just about the hole in the patient, it's the hole in the patient of any age. So again, whether it's an older person or a child, we need to think about age as a problem as well. So dressing selections then really depends upon what you're asking the dressing to do. So factors influencing selection, first of all, could be the bacterial profile, so the wound type, the depth and the cause. So why is it so deep? Is there an infection already in there that's making it go deeper? Have you got to keep it open and wide for a longer period of time? Or alternatively, was it trauma? So what's going on there on the wound type? The wound characteristics is by, do you want it to be dry and moist? Do you want to take fluid off of it? Is it really painful? Is it going to be difficult to dress? Is it liable to bleed easily? And then we need to think about those 4 stages of healing. So what stage of the healing are we? And then finally, we need to think about the tissue type. So is it necrotic, sloughing, granulating, or epithelializing? So the client's choice, you know, it's always about the client's choice and an informed choice here. But again, knowing how sensitive the person is, knowing how fragile the skin around the area is. So there's no point dressing a wound if we're going to cause further trauma to outside the wound with poor dressing choices. We need to think about the hygiene needs of this person. So how are they going to bath or shower? Is this going to affect their dexterity and mobility? So are we causing a knock-on effect here as well? And, you know, we need to be thinking about other complications that we spoke about earlier. Yeah, and if we look at this picture, obviously, gradually Jeff wished he'd never started pulling off that loose bit of skin from his fingernails. So again, we want to avoid causing further trauma. So we know we've got those 4 stages of the healing process: the homeostasis, inflammation, the proliferation, and the maltration stage. We've got those 4 stages. So again, just knowing what we need it to do at those particular times will heavily depend upon those dressings. So again, thinking about, are we encouraging natural healing? Are we trying to maintain inflammation? Are we trying to support collagen buildup? Or are we trying to build strength? So again, thinking about those dressings at those particular stages. It really is your responsibility to learn all of these, and different products will do different things. So again, there's no such thing as a stupid question here. There's different dressings for treatment of chronic pains. There's different dressings for obviously dealing with acute pains. So we need to think about the dressing. Is it comfortable? Does it cover that particular area? Is it going to maintain the fluid handling and taking off that? Is it going to allow odor and absorption? And is the ease of the application, can we take it on and take it off easily? Is there some antibacterial part to it? Is there ease of use? So all of these questions we need to think about. So how do you choose your dressing, and what do I want to do here? So we need to look then at are we looking for it to rehydrate? So to keep the moisture, put a bit of moisture in because the skin's really dry. Are we looking for it to absorb because the skin's too wet? Are we looking for it to reduce bacterial contamination? So are we looking for it to have some kind of barrier? Are we looking for it to promote that granulation? Or are we looking for it to promote a moist or dry wound bed? So again, asking those questions is really important. We need to maintain that moisture balance. So too wet, we need to remove moisture, absorb it, debridement, and treat infection. So we may have to take off a bit of the skin layer. So debridement is removing the top of the healing process, and then again treat that infection. But if it's too dry, then we may need to add moisture, and we need to keep this optimized wound bed in play. So equally with holes, fill in the dead space. So dead space must be filled with a dressing to ensure that the wound closure is delayed until the space has been replaced with granulation tissue. So we're looking at the cavity, the underlying tissues, and then tracts. So here, if you remember what we said, if we allow it to dry out and it heals over the top, you've got this tunneling and tracking that can happen underneath. So we need to delay that healing process so it gradually granulates the tissue and heals slowly from the outside in. So that's what we want to achieve. So make sure you can get in and out in one piece. So when you pack it, you need to make sure that what you're packing it with is an approved item and it's going to work properly. Remember, If there's no blood supply, keep it dry. So unless you're 100% sure there is tissue, visible tissue beneath, or you've been advised by a tissue viability specialist or responsible physician. So again, we want to make sure that we're selecting the right things. If we're not sure, obviously always seek help. So different dressings perform different things. So we've got gel dressings and foam dressings and dry island dresses and absorption dressings and packing dressings. So it's about picking the right type of dressing for that person. So here, the hydrogel dressings. So we're looking, it comes in sheet or gel, high water content, and it's designed to rehydrate. Types of dressings, these sheets are used for shallow wounds and cavity edges, and gels are they're used to help support those cavities as well. How and when to use. So we're going to change it between 1 and every 3 days. So again, your dressings will give you the dates to change. Normally you would put the date, obviously you can put the date on the sticker and stick it on the dressing so people can see it, and in the care notes. But apply onto wound and cover. And again, it's about taking heavily, dealing with the micetration and the secretion of the petty wound area and dealing with infections. So the gels, so these are the gels in which you can squirt into. These are different types of gels in which you can fill to hydrate and fill cavities and areas. So again, if you had to use a gel, they're what they look like. I've only ever used the one that's got the blue bits on the tip, and they're the only ones that I've ever seen used. But again, there are lots of different types out there. So looking at different dressings, so we're looking at dressings to promote homeostasis, different shapes. Some can be made from seaweed. Wound types, looking at heavily to ensure wounds of all types. Remove, change up to every 2 to 7 days, and you can use it as a second dressing, so you can use it in line with something else. And again, great for dry wounds and necrotic wounds, so those black wounds. So again, there are some of those there which you can look at. Hydrocols, sides, I don't think I'm saying that right, but anyway, looking at those, you've got, they can be waterproof and adhere to the, so these would keep the moisture in and obviously stop more moisture going in. Wound types for clean wounds when they start to coagulate, or necrotic wounds with low or moderate to exudate something. So primary dressings for epilizing wounds, so when it's going through that final phase is there. How and when to change every 3 to 7 days, requires a margin around between 1.5 and 2 centimetre margin. And again, that's because you're trying to seal it in and making sure it keeps moisture in, and obviously requires for that nice slow healing process. So other dressing types there, a type of wound dressing for totally cover the wound bed, sealing it off from the environment, and again keeping that moisture in, promotes a moist environment, stimulates the healing process, reduces the frequency of dressing changes, that's what you want, and allows protection. And those are those more padded gels, so they last a bit longer, have a bit more protection in there, and are really good. The foams, absorbent, so foam dressings, good for taking fluid out of things. Wound types, light to heavy. Obviously, you can put on the beds. The dressing needs to make sure it goes to the edges. It can be used as a secondary type on appropriate bandage if the product has already got a border. And you can use films to cover those. We'll talk about this in a second. And considerations there. So very dry, it's sloughy or necrotic wounds. So thinking about those. and those are the island ones. So you've got the bit around the edge and then padding there. So gel in fibers, again, they've got treatments in there. So they've got sodiums and things in there to help the healing process. Types of wounds, you're looking for medium to heavy to highly weakened wounds. That may be useful for infections as they hold the bacteria and they help manage infection. Apply the wound dressings with at least 1 centimetre margin overlap to the skin. And again, you can see they look a bit like what we've just seen as well. And then the films, so looking at things like tegaderm and things like that, are highly moisturous and transparent, using both as a primary and secondary dressing, so you can use it on its own or with something else. They don't absorb anything because it's just a dressing. Normally used to keep infection out. Great for burns and just that top of those dressings there. Frequency change as and when they need. And again, you can see those because they're like your dry dressings, and they obviously just encourage that healing process. Wound contact layers. So again, looking at different types of dressings there. Secondaries are required. Wound types, especially for the epilathon stages. So once it's started to heal, and apply directly to the wound bed. And that's things that you can apply on top of the wound just to stimulate tissue growth. Island dressings are great for skin tears and things like that. Primary dressing for light wounds, wound type, low wounds, and again, they look like that, and they're dead easy to apply. So again, same principle, the padding in the middle is used for absorption and all of that stuff. Iodine dressings, so these are the ones that are quite orange. Looking for wounds that are slightly infected or wounds that have got going through the sloughing stage. Apply directly to the skin with a small margin of overlaps. And again, you've got those ones there. So that could be your primary, and then you would add a secondary layer on the top. Honey as well. Looking at medical honey or high-grade honey, you can apply to the wounds. It can eat the infected areas of the wounds. You can apply directly and should be changed. And obviously, dressings can be cut. So that's what the honey dressings look like. Silver, looking at the properties of the silver ion, interferes with bacterial areas, infections. Consider for non-healing wounds. How to use when change may vary. Pay attention and other things that I've never seen silver used. But again, that's not to say it's not a choice. PHMB, looking at antibacterial properties, binds to cell membranes, causing holes to form the cells leaks. So obviously forms of gauze of liquids or gels. Wound types, you're looking at non-healing wounds. So this is to kind of really stimulate those new stages of growth. And again, that's what they look like. So we need to have a think about tissue type. So necrotic, obviously, is where it's black. You've got that sloughing stage. We need to debride and remove, treat the wound, and obviously deal with the infection. So that's necrotic, there, the black, and the sloughing, which is the orange bit. Sloughing is a mixture of fibre and proteins, serous graduates, it's grey. Treatment, remove slough and provide clean base for granulation and the healing. So if you see the sloughing, we would irrigate that, give it some kind of clean. So that's the sloughing stage 2. Again, we need to remove that and allow natural tissue to grow again and deal with that. Granulating is the capillary looping, the proteins come together, the red granulation appearance, treatment, protect and promote granulation, so carry on doing what you're doing. And again, that's the granulation where it's all coming up around the side and it's all going a bit lumpy and whatever, and that's where you need to be. And the epithelial inside, so the epithelial cells across the wound, that starts to come together, pink in treatment, protect, and maintain. So again, you can see there, that's the stages of healing. Obviously, an infected wound, we need to manage the pain of infection, treat as appropriate, isolate, apply any topical creams, and then redress. And obviously, any other exercise management, avoid for split factors. So again, just making sure that we're following anything there. So your take-home messages, there are many different dressings and treatments choices available for clinicians. You need to work and familiarize yourself with first-line treatments as they are cost-effective and evidence-based. As the clinicians may tell you to be clear about what the desired outcome for each requirements are, and the client before communicating the dressing selection, and the treatment choice should be based on a clear understanding of the benefits and limitations of each product. So keep it simple about moisture balance. Use the scale. If you don't have one, adopt one or develop one. Assessment is key, and know the products and what you're talking about. So ultimately, what we're saying here is there is a lot to consider when looking at wound dressings. And again, if you read the boxes in which the wound dressings come in, they do tell you what they're for and how you can use them. Anyway, I apologize, that's not one of my strongest subjects as a nurse, because we don't do a lot of wound dressing in mental health, but the slides are there, the modules are there below, and obviously it's giving you an overview and an insight about wound dressings and management. Anyway, take care, and I will see you in the next video.